In the face of increasing criminalization and harmful sensationalized reporting of gender-affirming care for trans people in the US, my research examines the history of trans do-it-yourself approaches, starting in the 1950s and their continued relevance today. Unlike the individualistic do-it-yourself or DIY mindset emphasizing independence or home repair, trans DIY is community-driven, more like do it ourselves. It consists of self-directed, underground efforts that trans people use to navigate gender transition and survival outside or alongside formal medical systems. For example, trans feminine people often use estrogen for hormone replacement therapy. DIY groups like Boobs Not Bombs risk legal prosecution to formulate their own topical estrogen. They test it for purity and safety, they share information about its use through zines, and they ensure access to those in need. Here in SF in the 60s, trans sex workers used to cross borders to obtain estrogen, sneak it back, and share it with their communities when institutions denied them care. DIY challenges the idea that only doctors should control healthcare. Because of medical gatekeeping, which is deciding who deserves care, restrictive insurance, legal bans, criminalization, and broader social inequities, most trans people historically and today don't rely on doctors or clinics for transition. Even in states where transition is legal and covered by insurance, many people still transition at least partially through DIY methods. As historian Jules Kill-Peterson notes, DIY is likely the most widespread form of transition in the worldwide, yet it's often dismissed as unsafe or unscientific. As a public health scholar, I ask, what does DIY transition teach us? It shifts legitimacy away from institutions and toward the people most affected. In trans DIY, materials, tools, knowledge, and labor are shared as communal resources, unlike hierarchical, profit-driven institutions such as the medical industry. We can learn from trans DIY practices, which include things like knowledge sharing, mutual aid, open access science and labs, collective care, depathologization, and divestment from pharmaceutical monopolies. These methods not only provide care, but also reclaim agency from oppressive systems while fostering solidarity. Trans DIY has long played a critical role in challenging the state. Much like during the HIV/AIDS crisis, when queer communities took care of one another, contributed to medical science, and kept records while institutions neglected them. Medical systems rely on DIY innovations, even as they cast DIY practitioners as deviant. At some point, we must give ourselves permission to embrace a new way of doing things. As welfare programs, nonprofit work, and civil rights are dismantled, we cannot rely on the state to safeguard our health and dignity. The trans DIY ethos is seen in harm reduction principles, political movements like the Black Panthers and the Young Lords. They teach us that autonomy over our bodies comes from understanding them, engaging with medicine, learning from one another, and building a new political economy of health rooted in collective knowledge and self-determination. Thank you.